Hello, Angel.
Hi, how are you?
I'm great. How are you doing?
I'm doing good. Life with three busy kids doing interviews in the car.
Okay.
Are we started or sorry?
Yes, we're all set.
Okay, I wasn't sure. All right. So I had a few questions for you about ADHD. When it comes to your kids, when is it that you draw the line between my kid's just really hyper and normal and my kid needs help and I need to get him or her assessed?
That's an excellent question, Angel. So ADHD is a neurobiologic disorder that affects about 6 million school children across the United States. And what we're really looking for are a cluster of symptoms, not just one. So difficulty with focusing and paying attention. This is the child looking at the classroom when the teacher is talking, or parents are speaking with them at the dinner table and they haven't even heard a word a parent has said. These kids also struggle with impulsivity, so they may interrupt adults when they're talking to each other or shout out an answer in the classroom before the teacher's even called on them. And of course, the symptoms of hyperactivity that you've been talking about, not being able to sit in a chair. This is the child that gets up 6 times to sharpen a pencil or run and get a drink of water. And I want to thank Pfizer for having me talk to you today, because this is ADHD Awareness Month, and it's really important for us to talk to parents and families about ADHD.
Absolutely. Now, and this is where my husband and I tend to disagree. His view is, well, you know, all kids have, you know, everyone's ADD to a certain extent, blah, blah. What's the point in getting kids assessed? You know, it's just going to be a bunch of pill pushers. So where do you, I understand that there's neurobiological things going on. So when is it really that you decide to medicate a child versus other more homeopathic remedies that you could be doing as well?
Well, I think that's an important thing. I think the first thing that I usually do is it's mid-semester grading period time now, and so it's a great time to have a check-in or a checkpoint with your child's teacher and get the next set of input to help reach that decision. Ask the teacher, are they handing in homework assignments? How is their test work done? How are their in-class assignments going? And if the teacher raises concerns, and then we've got one parent saying, I'm worried, and one parent saying no, the next thing to do is to go to your family physician and say, we've got some concerns about ADHD, the teacher's raised this, would you assess my child for ADHD? If the physician then weighs in, yes, I think it's ADHD, you have a variety of options available to you and your family. Those include things like educational interventions, smaller classroom size, tutor for math, sitting in the front of the classroom. Behavioral intervention or therapy can also be helpful for ADHD. And the third option, of course, is medication. And we have a variety of medications available. We've got skin patches, we've got pills, and we've got long-acting liquid preparations. And if you're interested in that, there's actually a website, ADHDCheckpoints.com, that talks a bit about the liquid preparation.
Okay, no, that's actually great information. Can you just tell me a bit more about how medication in children has evolved? I mean, I remember growing up, ADD and ADHD was more of a new thing, and you heard about all these kids on Ritalin that were just essentially stone-looking all day and no more personality, and there was a lot of controversy around that when I was growing up. So can you just maybe explain a bit more how medication has evolved since then and more what we see today, either in side effects or whatnot?
I think medication's involved in that we have more choices, and we have both short-acting preparations like you've talked about and longer-acting preparations, and it really is an individual decision. In terms of side effects of medication, all medications have side effects, and that again is a time to circle back to your doctor and ask, when they're starting a prescription for your child, what are the commonly seen side effects? What are ones that may mean we need to adjust the dose? and what are ones that may mean we need to switch. And that is an ongoing discussion, just the way anytime you give your child a medication, you have a discussion about side effects, what are we looking for in terms of results, and what are we tracking to see if we need to change the dose or change the med.
Yeah, that makes a lot of sense, and actually you raised a good point when you say that there's a lot more choice than there was prior. If there was no choice to change, you're kind of stuck with what you've got. If there's a choice, then you can move to maybe something that works better. So that's great. So what was the website again that parents can go to get more information about the liquid medications?
That website again for the liquid preparation is ADHDcheckpoints.com.
Okay, perfect. And are there any other resources that you can recommend for parents, whether it's for, sort of like a personal, does my child have potentially issues, or even when it comes time to dealing with kids who have already been diagnosed?
Yeah, two of the more general websites that are helpful for parents are the American Academy of Pediatrics website, which has a section on ADHD, and then CHADD, which is CHADD, which is a support group for children and adolescents and their family members with ADHD.
That's awesome. Well, thank you so much for all the information. I'm sure my readers will really appreciate it. I appreciate the information, actually. We never know with some of our kids sometimes. But thank you for taking the time this morning to talk to me about that. I really appreciate it.
And thank you for having me.
Oh, it's my pleasure.